Abdominal pain is the most important presenting abdominal symptom, the other being nausea, vomiting, diarrhea, constipation, obstipation, upper GI bleed, lower GI bleed. So, today we will see about the causes of the abdominal pain. So, let's start. So, let's see some mechanisms of pain originating in the abdomen first. First, see the pain. Abdominal pain can be due to the abdominal cause, or it can be due to extra abdominal cause. Moreover, it can be due to some endocrinological problems, metabolic causes, and neurogenic causes. There can be some psychiatric causes and toxic causes as well. So one by one, let's see. First, let's see the pain, abdominal pain originating from the abdomen. So, or abdominal pain originating from the abdomen can be due to the infection, inflammation, obstruction, vascular disturbances. So, these pain vary in site and nature and aggravating and relieving factor. So, first see the inflammation of parietal peritoneum. Pain originating from the parietal peritoneum is due to inflammation caused by leakage of luminal contents. See, friends, the abdominal hollow visceral organs like GIT, intestine, like a stomach, intestine, the gallbladder. These contain certain things like stomach contains acid, and gallbladder contains bile. So if due to trauma or ischemia or perforation, as seen in ulcer or typhoid, there is leakage of luminal contents, and these luminal contents may cause inflammation of the peritoneum. And since the peritoneum is supplied by the pain sensitive nerve endings of the by the somatic nervous system, so there can be pain. So the intensity depends on the material to which the peritoneum is exposed. Like if the peritoneum is exposed to gastric acid following a peptic ulcer, perforated peptic ulcer, then the pain will be very severe in intensity. On the other hand, if it is exposed to bile or blood, or let's say urine, then these are not responsible for major pain. These cause mild pain. Site is diffuse. Now, pain due to obstruction. Pain due to obstruction can occur due to obstruction in the intestine, obstruction in the biliary tree, obstruction in the ureter. So, pain due to obstruction is colicky in nature. Colicky pain is intermittent, intense, severe pain. It is intermittent and intense because it is due to the peristaltic webs. Let's say, for example, intestinal colic. Uh, Due to the intestinal obstruction, there is hyperperistalsis, and when the peristaltic webs come, uh, the patient experiences severe pain. So the pain due to intestinal colic is felt in the umbilical region. Uh, the small bowel obstruction pain is felt in supraumbilical region, and colonic obstruction pain is felt in infraumbilical region. Biliary colic is due to the obstruction in the biliary tree, and it is felt in the right upper quadrant, and it is radiated to the right shoulder. See, in acute cholecystitis, there is acute dilatation of the biliary tree, so the pain is severe. But in carcinoma head of the pancreas, there is a gradual obstruction and a gradual distension of the biliary tree, so there is mild right upper quadrant or epigastric pain. Pain due to pain due to vascular cause. Pain due to vascular cause is diffuse and continuous pain, and there is no guarding rigidity or rebound tenderness associated with it. Any pain which is out of proportion of physical findings, then we should suspect a vascular cause like superior mesenteric artery occlusion. Uh, thrombi or emboli may cause severe acute pain. Besides the pain uh, due to the abdominal source, the abdominal pain can be because of the extra abdominal causes. Among the extra abdominal causes, there can be cardiovascular cause or respiratory cause. Cardiovascular cause, like in inferior wall MI, there is pain in the right epigastrium. Also in pneumonia of especially the lower lobes, which irritates the pleura and the peritoneum, there can be upper quadrant pain. So in upper quadrant pain, a differential diagnosis of cardio thoracic disease should be kept as a differential diagnosis besides the uh, pain due to abdominal causes. So how we differentiate whether the pain is due to abdominal cause or due to the thoracic cause? See, both may present with upper quadrant pain, but if it is due to thoracic cause, there is a respiratory lag which may be present in the affected side of the thorax, and in if the cause is abdominal, the abdominal muscle spasm persists during inspiration and expiration. But if the cause is thoracic, the abdominal muscle spasm during inspiration reduces. Now, besides the cardiovascular and pulmonary cause, there can be other causes like torsion of the testis, or maybe some problem in the spine uh, causing the compression of the nerves. So how we differentiate it from pure abdominal cause? So in torsion of the testis, the pain is accentuated by pressure on the testis or seminal vesicle, and if the pain is referred to the abdomen due to pathology in the spine, it is accentuated during cough, sneeze, and change of posture. Among the metabolic causes, diabetes presenting as diabetic ketoacidosis is a very important cause. Uh, Diabetic patients often present with diabetic ketoacidosis with the symptoms of hypotension, uh, vomiting, and abdominal pain, small breathing. Besides this, the other metabolic causes can be hyperlipidemia. Hyperlipidemia per se can cause pancreatitis, which can lead to abdominal pain. Uh, Abdominal pain is also a hallmark feature of familiar Mediterranean fever. In the toxic causes, there is lead poisoning, insect or animal invenomation, snake bites. There can be functional disorders like bowel disease and inflammatory bowel syndrome, and there can be some psychiatric cause uh, like psychiatric problem with somatoform disorders. Pain due to abdominal pain due to neurogenic cause is burning in nature, and it is limited to the distribution of the peripheral nerve, and often the pain is caused by uh, non-painful stimuli like touch, temperature, and sometimes pain is even present at rest. And unlike in obstruction or ulcer or metabolic causes, it is not associated with neurogenic problem is not associated with nausea, vomiting, and distension of the abdomen. There is no rigidity, and it is not associated with food intake. It is caused by the herpes zoster, syphilis, diabetes, impingement by arthritis, tumor, herniated nucleus pulposus. You might be knowing about the post-herpetic neuralgia uh, as a complication of the herpes infection. Syphilis in the later stages can cause the neurological symptoms, and diabetes causes neuropathy and may present with abdominal pain. Arthritis and tumor may compress nerve and cause the pain. So, what are the key components of history which should be considered while taking history of pain? So, site of pain, nature of pain, radiation, aggravating or relieving factor, and associated symptoms are some of the important key pointers which should be kept in mind while taking history of abdominal pain. So, the site of pain. The abdomen is divided into 9 regions. They by two vertical and two horizontal planes. The two vertical planes passes through the mid clavicular line, and the upper horizontal plane passes through the transpyloric plane, that is the pylorus of the stomach, and the lower lower horizontal line passes through the transtubercular plane, and these four lines divide the abdomen into 9 regions. In the right hypochondriac region, liver, gallbladder, and part of a small intestine are present. So, right hypochondriac pain can be due to hepatitis or cholecystitis. In the epigastric region, stomach and pancreas are present. So, ulcer and pancreatitis presents with epigastric pain, while a splenic injury can present with left hypochondriac pain. Renal and ureteric colic present with right lumbar and left lumbar pain. Pain in the umbilical region and radiating to right iliac fossa is a classical presentation of acute appendicitis. Uh, Urinary bladder obstruction and ureteric obstruction may present with hypogastric pain. Left iliac pain is due to diverticulitis. Now, the nature of pain. The abdominal organs and the visceral peritoneum is supplied by autonomic nervous system. So, the visceral pain is deep seated and poorly localized and diffuse. Visceral pain from foregut is felt in epigastrium, from midgut is felt in umbilical region, and from hindgut is felt in hypogastrium. Muscles of abdominal wall and the skin are supplied by the somatic nervous system. The lower six intercostal nerves, the anterior cutaneous and lateral cutaneous branches of lower six intercostal nerve, the iliohypogastric nerve, and the ilioinguinal nerve. Central portion of the diaphragmatic peritoneum is supplied by C4 nerve root. So when an inflamed viscera touches the peritoneum, the pain becomes localized and sharp. Aching and constant type of pain is due to peritoneal inflammation and visceral pain. Colicky pain is due to obstruction. Colicky pain is sudden, severe, intermittent pain, as I already told you. Now, colicky pain can be a small bowel colic, biliary colic, or ureteric colic. The biliary colic is in the right upper quadrant. Ureteric colic is in the right lumbar, left lumbar, and hypogastric region. The small bowel colic is around the umbilicus. So a small bowel colic is due to peristalsis. The peristalsis tries to overcome the obstruction. So hyperperistalsis occurs, and when peristaltic wave comes, there is a pain. And after a few minutes, the wave disappear, and so the pain also disappear. But in biliary colic, the colicky pain persists for 30 minutes, and there is no intermittent the relaxation in between. That is, there are bouts of colicky pain, but there is a basal level of pain which is always present, and colicky pain remains for about half an hour. Ureteric colic is intense pain lasting for 1 to 2 minutes. Burning pain is due to neurogenic causes. Now, radiation. As I told you, the central portion of the parietal peritoneum of the central portion of the diaphragm is supplied by the C4 nerve root, and the shoulder tip is also supplied by the C4 nerve root. So, in a splenic injury, when there is accumulation of the blood and when it irritates the peritoneum of the diaphragm, the pain is referred to the left shoulder tip. Referment to the back or front. When inflamed organ touches parietal peritoneum, the parietal peritoneum is supplied by the pain sensitive somatic nervous system. So the pain is referred to the back or front in the same dermatome to which the somatic nervous system is supplying. So in acute cholecystitis, the right upper quadrant pain may be radiated to the back or the front. Suprapubic pain is due to obstruction of the ureter, and suprapubic pain radiating to penis, scrotum, and upper aspect of inner thigh is due to obstruction of intravesicular part of ureter. We can see the obstruction of the ureter in three parts: the pelviureteric part, and the intravesicular part, and the rest of the ureter. The obstruction in the pelviureteric part causes pain in the costovertebral angle, and pain due to obstruction in the intravesicular part of the ureter is suprapubic, and it radiates to penis, scrotum, and inner aspect and upper aspect of inner thigh. While rest of the ureter, the pain is in the flank of the same side. Epigastric pain radiating to back could be due to acute pancreatitis, peptic ulcer perforation, and ruptured aortic aneurysm. The in acute pancreatitis and peptic ulcer perforation, ruptured aortic aneurysm, the contents which are released irritates the peritoneum, and so the pain is radiating to the back. Pain around umbilicus radiating to right iliac fossa is a classical presentation of acute appendicitis. Now the associated symptoms. Right upper quadrant pain radiating to left shoulder associated with food intake. So the association of the pain with intake suggests biliary colic, because when food is consumed, cholecystokinin hormone is released, and this cholecystokinin cause contraction of the gallbladder, and when gallbladder contracts, there is severe sudden pain. Periumbilical pain. Periumbilical pain is due to the obstruction